Hi everyone. For those of you that don't know me, my name is Sarah Cox. I'm the behavior specialist at B. Bernice Young School in Burlington Township. Today, we're going to go over a brief introduction to applied behavior analysis, also known as ABA. First question, what does ABA mean? What is applied behavior analysis? If you Google this term, you'll find many different definitions. This one, personally, is my favorite. ABA is an approach to changing socially useful behaviors that employs scientifically established principles of learning to bring about these changes. So what does this mean? Let's look at some real life examples. Our economy is based on the principles of ABA. We all go to work every day and we earn money. This money is then used and exchanged for preferred items and activities. Think of the students you work with. Many of them complete work to earn access to things that they enjoy. Very similar to the way our economy works. Also, you can go ahead and look at the prison system. If you dive a little deeper into that, you'll find that many token economies are used in the prison system. There's also often a level system involved, where privileges increase based on good behavior. Also, another great example of how ABA is used in our world. So let's look at the clinical application. Applied behavior analysis can be used to reduce problem behaviors. Most commonly in the research, we see those problem behaviors as being aggression and self-injury. We want to identify an observable target behavior. Pay attention to the word observable there. We can't reduce a behavior unless we can describe what it looks like. Has to be an observable target behavior. Once we identify that behavior, we operationally define it. Here is an example. Disruption. Any occurrence of Paul throwing objects, not at a person, swiping objects off tables, knocking over objects, includes attempts. This is an operational definition, meaning it describes exactly what the behavior will look like and provides some examples. In ABA, there's a lot of assessment. First assessment we'll go over is a functional analysis. Functional analysis is used in most clinical settings. It involves 10-minute conditions in a session room with very specific scenarios. It involves manipulating the environment to try and evoke problem behavior so we can identify what variables are maintaining the occurrence of that behavior. Each condition is specially designed, and we'll get into that in just a moment. In each condition, specific reinforcement is provided contingent on that target behavior. Before getting into each individual condition within a functional analysis, let's get some background. Research has shown us that there are primarily 4 functions of behavior. First one is attention seeking. We often see that individuals, or in our case, students, will engage in particular behaviors to gain attention from others. In schools, we may see that attention seeking behavior before the attention from adults or attention from peers. We also often see escape maintain behavior. So an individual, again, a student in our situation, may engage in a particular behavior to get away from a task. Tangible access. This is when an individual engages in certain behavior to gain access to preferred items or activities. A good example of this, you may see a child throw a tantrum in a grocery store near the candy aisle. At some point in that child's life, that tantrum has gotten them access to candy. So they may continue that behavior to try and gain access to the candy. The 4th function of behavior is automatic or self-stimulatory. This means that independent of environmental variables, the individual will continue to engage in that behavior because it is self-stimulatory in some way. Our 5th condition in a functional analysis would be a control condition, or play. So this is the child's perfect world. We provide unlimited access to items and attention to keep a low rate of problem behavior. Let's get into the different conditions in a functional analysis. First condition will be an attention condition. During this session, we are trying to determine if the target behavior is maintained by access to attention. Remember, these conditions occur in a small session room, typically with limited materials. There is a very specific script for the therapist for each condition as well. You'll see that as we go through. To begin this condition, a brief sample of attention would be given to the individual. That attention would then be removed, and all behavior would be ignored except the target behavior. Immediately following the first occurrence of the target behavior, 30 seconds of attention would be provided. This may seem opposite to what you're taught in the schools. If a child engages in behavior, you're not going to want to reinforce that with attention. Within this functional analysis, you'll see that we are always providing reinforcement for that behavior because we want to see that behavior occur again. Some related conditions to the basic attention condition may be a divided attention condition. This is when an individual is working with you one-on-one, but then you need to split your attention between that individual and another individual. You can manipulate this condition in different ways based on the information you have. Let's take a quick look at some attention-seeking behavior. Notice that the child only screams and cries when attention is made available. The second condition is the escape condition. This is when we are looking to see if the target behavior is maintained by getting away from a task or a situation. During this condition, we would provide demands consistently. These may be academic demands, as you see below. They also may be physical demands. We may find that an individual engages in target behavior when there are hard tasks presented or when there are easy tasks. These nuances and specific variables would be manipulated based on information we already had about the student. So in this condition, we would provide demands and contingent on that target behavior. So as soon as that behavior occurs, we would allow a 30-second break. We would then represent the demands, and once again, if that behavior occurred, we would continue to provide those breaks. Our third condition is the tangible condition. This is when we are going to assess to see if a student is engaging in a particular behavior to gain access to things. During this condition, we would begin by providing brief access to a preferred item or an activity. We would then remove that item or activity and only provide it again immediately following the occurrence of target behavior. This would continue for the 10-minute condition. Some related conditions, again, based on information that we had gathered prior to the assessment, we may find that a particular child may engage in problem behavior to gain access to food, but perhaps not to leisure items. So we would be sure that each condition involved high preferred food items versus toys. Let's look at a quick example of a child trying to gain access to an item. You may have experienced this yourself, or you may have witnessed this in public places. It happens every day. The child wants a toy, dad says no. Let's take a look.
Put it down. Put it down. Put it down. We'll pick a toy from the front of the store.
Perfect example of reinforcement. The child wanted the toy. She cried, and Dad said, "We'll get a toy from the front of the store." So the function of that behavior may be access to tangibles. She didn't get the item she wanted, but she got a backup item for engaging in that behavior. Most often, this occurs in the real world, so the adult can get out of the situation. Personally, I don't have kids, but if I were in a store and my child was screaming and throwing a tantrum, I would want that behavior to stop as quickly as possible. So I may give in and give access to those items that the child wanted, just to end the tantrum behavior. So now that we've seen an example of a child engaging in problem behavior to gain access to a preferred item, let's move on. Our next condition is going to assess whether or not the problem behavior is automatically maintained. In this condition, the child is left alone with no access to attention or preferred items. He or she is of course being monitored and data is being collected. Nothing is provided contingent on target behavior. If we consistently see behavior occurring in this condition, we may be able to conclude that that behavior is automatically maintained. In other words, independent of any variables that we put into play, the behavior is most likely still going to occur. Now that we've run all of these conditions, and they are typically run a number of times, let's look at how the data is summarized. Here's a typical graph from a functional analysis. This can be tricky to look at, so let's go ahead and go through it together. Let's look first at our alone condition, which is denoted by the black diamonds on this data path right here. You can see that in the first alone session, 4 occurrences of the problem behavior occurred. In the second session, 3 occurred. In the third, 6 occurred. And in the fourth session, 5 occurred. Let's look at our attention condition, denoted by the black squares. You can see on this data path that problem behavior consistently occurred during these conditions as well. Moving on to our escape condition, which you can see is elevated above all the other data paths, meaning that the highest rate of problem behavior was recorded within the escape conditions. Then we can go ahead and look at our control condition. We'd like to see a rate of 0 in all of these sessions, but you can see that in the second session, it does seem that some problem behavior was recorded. That's okay. We still are able to conclude that the individual is most likely to engage in problem behavior when he or she is trying to get out of something. Okay, so now that we have reviewed functional analysis in a more clinical setting, let's look and see how that translates to schools. How can all of that be done in school? Think about it. We don't have access to a session room. We don't have all of the time that is needed to complete a functional analysis. The children still have to go to their classes and participate in their activities during the school day. So in schools, we do something called a functional behavior assessment. It's a modified version of a functional analysis, rooted in the same basic principles of applied behavior analysis. There are about 6 steps involved in doing a functional behavior assessment, or an FBA. Let's go ahead and break these steps down. You can tell that step 1 and 2 are very similar to what we discussed in doing a more clinical functional analysis. We need to identify and define the behavior that we're looking at. What is the target behavior? We have to operationally define it based on the information that we are able to collect. For example, we may hear that a first grader is engaging in aggressive behaviors. We may hear that a third grader is engaging in disruptive behaviors. Those behaviors are going to look very different, and we need to collect that information from the teachers and the staff working with the student. So now what? We've identified the target behavior and we've operationally defined it. Step 3, we need to take data to determine the function. You may recall that during a functional analysis, to determine the function, we complete multiple sessions and conditions in a very contrived environment. As we stated, we don't have access to that environment and those conditions in a school setting. So we begin with data collection. ABC data. We'll get into that in a moment. We may also collect frequency data. So how many times does that behavior occur in a day? We may look at duration data. Perhaps a child is engaging in long periods of non-compliance, not doing their work, not following directions. How long does that behavior last? What's the duration of the behavior? We also want to look at severity or intensity. One child may be engaging in aggressive behavior, and it may be a slight push or a shove. Another child may be engaging in aggressive behavior that looks like punches or biting. So let's go ahead and take a look at ABC data. ABC is a 3-term contingency used in ABA. A stands for antecedent. What happened before the target behavior occurred? B stands for behavior. What specific behavior occurred? And C for consequence. What happened immediately after the behavior occurred? Here's an example of a chart that we use to collect this information. On the left-hand side, you can see that the date and the time are collected, the initials of the staff member collecting the information, so we can follow up if we have any questions. Next column, we have our setting. Where did the behavior occur? Was the child in a classroom? Were they individual, one-on-one? Were they in a special? Next column is the A for ABC, antecedent. What happened immediately before the behavior occurred? Did the teacher give a direction? Was there a peer conflict? Was there denied access to a preferred item? You can tell that many of these are structured around those 4 functions of behavior that we've reviewed previously. Our B column, or behavior, what was the specific behavior that occurred? This may be personalized in some situations depending on what we're looking at and depending on the student. You can see that the C column for consequence is left open. That's because many different things can happen immediately after the behavior occurs. A teacher may deliver a verbal reprimand. The child may be completely ignored and peers and teachers don't pay attention to him or her. All of those things would be documented in this area. Lastly, we have our student reaction. How did the student respond? For example, if a verbal reprimand was given, was the student affected by it? Did they shout something out? Did they sit back down and get back to work? What occurred after the consequence was delivered? All of this information is collected and charted to help us to determine the function of the child's behavior. So let's check in on our process so far. Step 1, we've identified our target behavior. Step 2, we've operationally defined that behavior so we know what it looks like. Step 3, we've taken data to help us to determine the function of that behavior. At this point, it would be great if it all summarized nicely and we were able to go ahead and complete step 4. Sometimes it takes a little longer depending on the specific behavior and depending on the student. Step 1 to 3 can typically occur over a few weeks or a few months. It depends on the data that is collected and how clear the function of that behavior is. Let's take a look at some function-based interventions. This chart is an outline of appropriate staff responses and inappropriate staff responses to problem behavior based on function. You'll see in our left-hand column, those functions of behavior that we've discussed multiple times are again listed. We have escape, attention, tangible access, and the non-social or automatic functions of behavior. For an escape maintained behavior, an appropriate response would be to redirect that child to the task. Or we could always teach that child to request a break from the activity. That would be much more appropriate than having the individual engage in aggressive behavior to get out of a task. An inappropriate response would be allowing that child to get out of the demand. We don't want to teach that child that that behavior gets them out of things. So we would go ahead and follow through with the demand. For attention-seeking behavior, an appropriate response would be to ignore the behavior Or again, maybe we're going to teach that child a skill to gain access to what they're looking for. So we're going to teach them to request attention appropriately. Maybe it's a simple statement of "play with me, please," or "can we talk for a minute?" An inappropriate response for attention-seeking behavior would be providing attention contingent on that behavior. We don't want to do that. We don't want to provide attention when a child engages in problem behavior. We want to teach them more appropriate ways to get that attention. For tangible access, we would want to redirect the child to the task and continue to restrict access to the item following the behavior. We don't want to teach them that they get access to items and activities contingent on problem behavior, similar to the video we saw earlier. An inappropriate response, we're not going to want to give them that activity. So if a child disrupts in the classroom because they want to play on the computer, we would want them to follow through the demands and earn that computer based on appropriate behavior. For non-social, automatic, or self-stimulatory maintained behaviors, response blocking and redirecting back to the original task is one of the best responses we can have. Response blocking is simply trying to block the behavior that's occurring. Maybe a repetitive behavior, something like that. We may also want to teach a replacement behavior, meaning, again, something more appropriate. We do not want to allow increased access to this behavior. We want to try and block it to the best of our ability. As I mentioned earlier, this can be a tricky category, so more information would be given if you are dealing with a child whose behavior is automatically maintained. Replacement behaviors. That term was used multiple times in our last slide. Let's look at that. An appropriate behavior must be taught to replace the inappropriate behavior. It's difficult to decrease a behavior just by manipulating the environment. We need to provide the child with new skill set to be able to gain access to whatever they were looking for. To decrease a behavior, we have to make the target behavior irrelevant and ineffective. For example, in the attention-seeking video we watched, the little boy continued falling. If the parents went over and gave a ton of attention, he's going to learn that that behavior is useful. We want to make that behavior ineffective. So we want to give him attention for doing other things besides falling to the floor. Another example, more school-based, we want to teach the child that screaming is not going to get them attention, but raising their hand and asking for attention will almost always give them the attention they're looking for. Here's another chart that highlights some antecedent interventions. Again, you'll see that on our left-hand side, we have functions, escape, attention, tangible access, and automatic. In our middle column, we have antecedent that occurred and the behavior that occurred, and then the intervention on the right-hand side. Let's go through a couple. For an attention function, if the child is engaging in property destruction when left alone for more than 4 minutes, an antecedent intervention would be scheduling high-quality attention at least every 3 minutes. Notice, we want to capture that time period before the child engages in the problem behavior, so they are receiving the attention on a schedule prior to the time that they would typically engage in that problem behavior. For an escape maintained behavior, the child can do the first worksheet, but throws materials upon the presentation of the second. We may schedule a short break between worksheets. These antecedent strategies provide the child with the function of their behavior, but non-contingent on their behavior. It's actually contingent on more appropriate, acceptable behaviors. All of these strategies will be put together into an individualized behavior intervention plan, or BIP. Once the function of the behavior is determined, a formal plan will be created. The document will include all of the specific antecedent strategies and interventions, in addition to how staff should respond to each behavior if it is to occur. Let's get into reinforcement. Reinforcement is used to increase the future likelihood of a behavior. We've talked a bit about giving tokens for appropriate behavior, like work completion, and those tokens can be turned in, similar to money in our real world, for access to preferred items or activities. A common misconception is that reinforcement is also known as bribery. This is not true. Reinforcement is set up ahead of time, so the child already knows what they need to do to gain access to something. Bribery would be if, in response to problem behavior, we then suggested, hey, why don't you do your work so you can have 20 minutes on the computer? That would be more of a bribery type situation. Bribery is typically a legal term though, and not used in the field of ABA. It's important that when reinforcing students, the delivery of that reinforcement is immediate. If a child earns at 10:30 a.m. and they don't get computer time until 11 a.m., there are a number of behaviors that could have occurred in that 30-minute period. We may accidentally be reinforcing the wrong behavior. So it's very important that when we have a reinforcement-based plan, it's immediate. Positive reinforcement. The definition is adding something desirable to increase the behavior. So we're adding something to the situation to increase the future likelihood of that behavior occurring again. Here's an ABC example. A child sees a friend with a truck. The behavior, the child points to the truck to ask for it, and then the consequence. Staff finds another truck for the child to play with. The child will then learn to point to requests for items. This example you'll see does not involve problem behavior. This is actually a real-life example of increasing a child's communication. I also want to point out that the term consequence, which we've used frequently so far, does not mean a punitive reprimand. Consequence simply means what is occurring after the behavior. Negative reinforcement. It's important to know the difference between these two types of reinforcement. Again, the term reinforcement is used, so we know we're looking to increase the likelihood of a behavior. But then we add the word negative, which is the removal of an undesirable stimulus to increase the likelihood of the behavior. Here's another ABC example. There's a loud noise in the cafeteria. The child asks to eat in the hallway, and the consequence is the child is able to eat in the hallway, which terminates the loud noise. So that stimulus was removed, and hopefully the child will request to eat in the hallway again. Punishment. Here's that word that most people think of when they hear the term consequence. In ABA, punishment is a completely different thing. Punishment is used to decrease the future likelihood of a behavior. Punishment should only be used when positive interventions are proven ineffective. You may have noticed that in your individual student's behavior plan, there typically is not an outline of how to use punishment. We always start with reinforcement-based plans. Despite that, let's get some background on punishment. Positive punishment. The introduction of an undesirable stimulus to increase the future likelihood of a behavior. Here's another example. Antecedent. Teacher gives a worksheet. Behavior. Child rips up the worksheet. Consequence. Child now has to do 2 worksheets. The child will now complete the first worksheet, so he or she doesn't have to do 2. That would be the hope based on this intervention. Let's look at negative punishment. The removal of a desirable stimulus to decrease the future likelihood of the behavior. So that term punishment is being used, so we know we want to decrease the occurrence of the behavior. And then the word negative is being used, so we know we're going to be removing something. Here's our ABC example. Child loses at Angry Birds. That's our antecedent. The child then throws the phone. The behavior. The consequence, or the response to that, is the phone is taken away. Our hope is that the child will be less likely to throw the phone again, so he or she can keep playing. So the phone was removed, that's that desirable stimulus, to decrease the chance that he or she throws the phone again. Here's a chart. This can be helpful when thinking about positive, negative, reinforcement, and punishment. It can get pretty confusing. So here we have increasing behavior. When we are looking to increase behavior, you'll see that we always use the term reinforcement. When we're looking to decrease behavior, we always use the term punishment. When we are adding a stimulus to the situation, we are always using the term positive. And when we're removing stimulus from the situation, we are always using the word negative. So now let's look at some schedules of reinforcement. Again, these are things put in place ahead of time. So you'll be trained on all of this information if you need to ever use it. Differential reinforcement of an alternative behavior, or DRA. We have a lot of 3-letter abbreviations in ABA. It can be a bit overwhelming, so hang in. We also have differential reinforcement of other behavior. So what do these terms really mean? DRA, alternative behavior. This is when we are going to reinforce a child for engaging in a more appropriate behavior. For example, we may have a child who is shouting out to get attention. We taught that child to raise their hand for attention. Every time that child raises their hand, we want to provide that reinforcement. We want to reinforce that alternative or appropriate response that we've taught. When looking at a DRO, or a differential reinforcement of other behavior, we're looking to reinforce for periods of time that the target behavior does not occur, meaning that child can engage in any other behavior, but as long as they do not engage in the target behavior for a specific amount of time or for a period, we would provide reinforcement. Here's some more about schedules of reinforcement. We may have a fixed ratio of reinforcement, meaning that we are going to provide reinforcement after a set number of responses. Perhaps we need the child to complete 3 math problems and then they will get a token. Or perhaps we need them to comply with 4 directions in a row before earning something. That's a fixed ratio. A fixed number of responses equals reinforcement. We may also use a fixed interval. So this is going to be more time-based. So reinforcement will be provided every 5 minutes that the child is on task. These numbers may seem arbitrary that I'm throwing out, but they would be based on data that we are taking for each individual student. We may also use variable schedules of reinforcement. So we have a variable ratio. So reinforcement would be provided about every 4 responses. Sometimes we use variable schedules to throw the child off and keep them guessing so they don't know when the reinforcement is coming, which can conclude in a higher rate of compliance or responding. We may also use variable interval schedule of reinforcement. So reinforcement will be provided about every 5 minutes or about every 10 minutes. Again, that variable schedule to keep the child guessing. So these schedules of reinforcement hopefully will increase the likelihood that we'll see appropriate behavior from our students. Let's look at some issues with reinforcement. Here's intermittent reinforcement. You'll see there's a picture of a slot machine. A slot machine is a perfect example of intermittent reinforcement. Every time you pull that handle, or I guess nowadays press that button, you may or may not win. It is a chance. You don't know when that big jackpot is coming. That typically produces a higher rate of responding, meaning you may put more money in because sometimes you win and sometimes you don't. So let's see how that can translate to schools. Occasionally giving in to the behavior can increase the frequency of that behavior. So we have a student who rips up a math worksheet every time it's presented. Monday rips up the worksheet, but the teacher has backups and provides a new worksheet each and every time, and he or she has to complete that task. Except on Thursday. Thursday comes and the child rips up the worksheet. The teacher is tired and says, "Fine, you don't have to do it then." That is intermittent reinforcement. She was following through on Monday, Tuesday, and Wednesday. On Thursday, the same behavior worked and it got him out of the task. We are more likely to see ripping of worksheets every day following that, especially if this intermittent reinforcement schedule continues. To avoid using intermittent reinforcement, it's best to follow the plan as it's written. Let's look at another side effect of a behavior intervention plan. Extinction Burst. During an extinction burst, a behavior may actually get worse before it gets better. We're battling with a very long history of reinforcement. Student may be engaging in a particular behavior at home and in school. So shouting out for attention may be working across both environments, and for some students, it's been working for years. We're now putting in a plan where they need to engage in a different behavior to get attention, a more appropriate behavior. So we may actually see an increase in not only the screaming, but more intense behavior when we're not providing attention. Here, our best example is a vending machine. Many of us use vending machines on a daily, weekly basis. We press the button, we get our food. Put your money in, press the button, get your food. What happens when you put your money in and you press the button and your food doesn't come out? I think most of us are probably picturing some banging, some shaking, some slamming into the machine. That is an extinction burst. The typical outcome of pressing that button gets you your food. When you press that button and your food does not come, your behavior increases in intensity, and it may increase in severity, depending on what food item that is, of course. So let's go ahead and check in. For our functional behavior assessment, we have identified the target behavior, we've operationally defined it, we have taken data to determine the function, and we have created our function-based plan. That function-based plan is most likely going to include some antecedent strategies, some reinforcement based on one of the schedules that we discussed, and staff response to the behavior. Step 5 and step 6 are very, very important. We have to train all of the staff members that are going to be working with the student so they're aware of how to respond to either the problem behavior or more appropriate and alternative behaviors. Step 6, we need to continue and evaluate the plan's effectiveness. This involves data collection, and that's where you come in. So what is your role in all of this? As one-to-one paraprofessionals or classroom aides, teachers, any staff member that's working with the student, it will be their responsibility to implement the Behavior Intervention Plan, or the BIP, another three-letter term in ABA. You're going to be responsible for implementing this plan as it's written. That training will occur and continue to occur throughout the year. But it will be your job to use those reinforcement strategies to hopefully increase the future likelihood of appropriate behavior. We also ask for data collection. We can't be with the student at all times, so we need to collect that data so we know how that plan is working. You may also be asked to do some data entry, but most likely not. Hopefully, when the behavior plan is implemented correctly, the data will show a decreasing trend in problem behavior and an increasing trend in things like compliance or those alternative behaviors that we're looking at. That is always our goal. But of course, this is the real world and things happen, and we may not always implement the BIP with integrity. Let's look at something called procedural drift. So when a plan is first developed and staff are trained, it's very often that plan is run with great fidelity, meaning we are on it. Every 3 minutes, that child is getting that token. Every response that is outlined in that plan is being followed. But over time, as the plan continues to be effective and a low rate of problem behavior is observed, we may feel that the child doesn't need that anymore. So the plan is not implemented with fidelity. See here where it says, do not stop implementing the plan because it is working. It may be working, and that's why the child is not engaging in behavior. If we stop implementing the plan, the behavior may resurface. Here's a quick example. Billy hasn't engaged in aggression in a month, so you stop rewarding him for the absence of the behavior. This may be okay for a few days, and aggression may remain low. But on day 3 of no rewards, Billy punches you in the nose. Oops. That plan was effective, and now without it, his aggression is resurfaced. Always run the plan. I know that was a lot of information. If we haven't said it before, we're saying it now. You guys are amazing. We rely on you. You guys are with these students every minute of every day. you're cheering them on when they're doing a great job, and you're having a quiet talk when they need a moment. Please don't ever hesitate to get in touch with us if you feel like something is going on with your student. We can't be with each and every student every single day to see how the plans are working, but the data that you collect and your communication with us is pertinent to the success of our students. As part of the ongoing process to evaluate the effectiveness of the behavior interventions that are in place, we will often come in to observe the student in the class. Remember that when we're in there, despite our presence, a class is still in session, so we have to be respectful. We may pull you out into the hallway to discuss things more privately, because remember, behavior should never be discussed in front of the student. So during this presentation, we've discussed a lot about the principles of ABA and how interventions are developed. Let's look at what some of those interventions might look like. Here are some common school-based interventions. Token board. See a picture down in the bottom right of an example of a token board. Token boards are often used at the younger level, but may be used at the higher grades as well. Delivery of tokens is given based on appropriate behavior. It also helps to serve as a visual reminder, and it may encourage the student to continue working hard. Often, the child is working towards a larger reinforcer, so they may be earning 5 tokens to gain access to something bigger. The delivery of each token is a moment to celebrate and reinforce the child. We may also use visual schedules. Visual schedules can decrease problem behavior during transitions. Sometimes a student just needs to know what's next. They need to know what's coming up, or when their favorite activity is. It can help to reduce anxiety, and in the moment, it may be more effective than spoken language. Social stories. Again, these may be used at a younger level, but they can still be effective at the higher levels as well. Social story includes pictures of a student and a story about the issue at hand. This can help to reduce anxiety as well. Some common uses: people will typically implement a social story when a child's going to encounter a new situation. So perhaps they're transitioning to a new classroom and they're going to be a bit nervous about it. Social story would tell them a little bit about what this situation is going to look like. Best practice is to use these on a daily basis to motivate and review behavior goals. They can also be used as a model for appropriate behavior. For example, sometimes I might get upset, but I remember to take a deep breath and count to 10. By reviewing this with the child in the first person, we encourage them to use this strategy. While we've reviewed just a few common school-based interventions, there are many, many more that we can always get into at a later time. But right now, let's look a little bit more at data. Data 101. Data, data, data. Everything we do to determine the function of a behavior and everything we do to put a function-based plan in place is based on data. We've already discussed ABC data. We use this for new behaviors when we're trying to follow a trend or see if there is a trend that exists to help to determine the function so we can put some interventions in place. We reviewed this earlier. We also have frequency measures. So once we put a plan in place, we may want to track the frequency of the behavior. How many times did that behavior occur? This can be done by using tally marks, as you see below, or you may even need to use clickers for high frequency problem behavior. Partial interval measures. If you have had a student where there's been data collection, the chart below may look very, very familiar. Partial interval measures measure whether or not the behavior occurred at least once in an interval. So let's look down here. From 7:30 to 7:40, the child engaged in at least one instance of teasing behavior, so this was circled as yes. From 7:30 to 7:40, the child did not call out at all, so this was circled no. Go ahead and move down each row and identify for yourself if the behavior occurred at least once or not at all. Let's look at whole interval measures. Seeing the chart below, compliance is most frequently collected using a whole interval measure. So did the behavior occur for the entire or whole interval? So looking here, 7:30 to 7:40, the child was compliant for the entire 10-minute interval. 7:40 to 7:50, the child was non-compliant at least once, meaning that they were not compliant for the entire 10 minutes. That brief moment of non-compliance may have just lasted from perhaps 7:42 to 7:43, but because they were not compliant for the entire 10 minutes, we go ahead and circle that as a no. Let's quickly take a look at some graphs. This information, when you're not familiar with the setup, can be a lot. So I'm just going to go through and highlight a couple things. This data was collected for, at the time, I believe he was a first or a second grade student at Beaver East Young School. You can see it was back in 2013, 2014. We had an individual who was engaging in tantrum-like behavior and aggressive behavior. All of this right here, all the black that's connected at the bottom, is when 0 rates of problem behavior were occurring. That is a very long time to have 0 rates of problem behavior. But you see these peaks, we were having random days where problem behavior was occurring. We were having difficulty to determine what changed. Why is the plan working here and then randomly not working in this cluster right here? And again, we return to 0 rates and the behavior continues to occur here. It didn't make sense until we were able to put this chart together and look at snow days. So for those of you that may remember, 2013 to 2014, we had a lot of snow days. And the child had difficulty coming back from those snow days. The change in the routine, for whatever reason, increased the likelihood that that child was going to engage in problem behavior. So our plan was effective when it was implemented consistently for a longer duration. This data collection by this paraprofessional helped us to solve what was going on. So I know there was a lot of information presented in this slideshow. I want to go ahead and provide my contact information. In case you don't work at Young School, you can always send me an email to follow up, and I can clarify anything you might have questions on. Please don't hesitate in getting in touch with me. Thank you very much, and I hope you guys have a great day.